possible and only use it when it's absolutely critical.
Thank you.
So we're going to go through some of the deal points, but it does make itself clear that the real stake here is the forgotten man. President Trump, I believe you won the election because you remember the forgotten man. You speak to them, they hear you, they listen to you, and he connects well because he actually does things that materially change their lives. Secretary Kennedy spoke passionately, as he always does, about the problems with obesity. And just to put some very fine point numbers on this, obesity itself is responsible for half of all chronic disease and definitely generates more than a quarter of all the money we spend out of CMS, the $1.75 trillion that we spend annually. We need to address this tempest of dramatically increasing prices for healthcare, and you're not going to do it just by throwing money at the problem. You have to actually literally deal with the causes of the increase in price, and pharmaceutical prices are a part of that. They've been a part of it for a long time, but this president insisted that we address it. In fact, the first time I heard this directly from you, sir, was in January at Mar-a-Lago, where he took Secretary Kennedy and myself, Mr. Ricks, who you'll hear from in a second, to dinner, and demanded explanations for most favored nation pricing and what's wrong with it. And there was not a good reason against it. Now, MAHA is critical. America will have to get fit in order to right-size the healthcare system, and MAHA has the answers. It has obesity management through diet and exercise and sleep and dealing with issues related to that. And I want to say it as clear as I can, obesity is not an absence of GLP-1 drugs. We're all clear on that. But as Secretary Kennedy said, it is an arrow in our quiver that we must use and should use. The MAHA movement means making it easier for the right things to happen, easier for you to be healthy. If you're sitting at home and watching, that's what MAHA means to me. Reducing costs of the #1 most expensive medicine category in our country for Americans does just that. It is as MAHA as it gets. Today's the 4th MFN. President Trump highlighted the first 3. Leading U.S. company, leading European company. We've dropped in fertility drugs, so we'll make lots of Trump babies, I'm hoping, by the midterms. But it's really about fairness. Fundamentally, it's fairness in pricing to Americans who have been getting ripped off, paying 3 times more than their European counterparts for the exact same product made in the same factory, in the same bottle, in the same packaging. We shouldn't be paying 3 times more, and we are no longer doing that. Fairness to the forgotten man also means dealing with the reality that they can afford a life-saving, life-changing drug that 10% or more of affluent Americans take, but folks without means can't manage it. Secretary Kennedy mentioned New York City. Actually, the #1 zip code is the Upper East Side, which is where you have property. And folks who know ritzy areas buy important real estate there because those real estate properties are worth a lot there. That should not be the #1 zip code in America for purchasing GLP-1 drugs. It speaks to the fact that we have an inherently, innately unfair system that penalizes folks who can use these medications the most, folks in the Rust Belt. Now, what are you supposed to do if the right thing to do for your health is right there, but you can't afford to get it? Folks need to be able to utilize these life-saving medications, and being fair about its distribution is essential. And we are democratizing access to these medications and dealing with a moral imperative to make sure that all Americans have access to avoiding all the obesity-related complications by making sure they can afford, if they do things right, not just MAHA appropriate interventions, but also medications like this. In fact, we think these deals, and this part's very important, we believe these deals within 2 years, by the time the ink dries on these contracts that were signed earlier today, within 2 years, based on our health improvements, we will be budget neutral. These drugs will not cost us money. The American taxpayers will be getting their money back. That's how important it is for us to reduce the cost of healthcare in this country, especially when it's due to preventable problems like obesity. In addition, we have an update, Secretary Kennedy. We thought it was 125 million pounds. Mr. President, our estimate, based on the company numbers as well, is Americans will lose 135 million pounds by the midterms. But I don't measure it in pounds. I measure it in saved lives. People can sleep again because they can breathe as when they go to bed. Folks whose knees don't hurt. People who don't have heart attacks, renal failure, dementia, all the things we know are associated with obesity and much more. This wouldn't have happened if we didn't have the right tools and had the ability with a team that has been spoken of early. So I want to call out Abe Sutton. He's in the back right there. He leads the CMS Innovation Center. It made the deal possible. And they are announcing today a new model, a brand new model aimed at getting to the vulnerable populations amongst us these medications. The forgotten man will be able to afford these drugs now. Governors will be thanking President Trump. They should be calling directly, sir, because they're going to be able to afford Medicaid next year in ways unimaginable, and they will stop crowding out education and other civil services. We cannot be a wealthy nation without being a healthy nation. That's why today's MFN deal is a historic step forward for all of America, and this is something that I don't think is partisan. There is no way you can argue against what just happened. These numbers to my side here, Administrator McCary, who's been instrumental in this process as well, $1,350 baseline. Chris Klump will go through the numbers, but just focus on that 245, which is what he's going to point you to. And Chris Klump has been an unbelievable leader, an innovator. You've heard his name before. He's spoken here before, but he is continuing to change the face of CMS, and I love the fact that with his leadership, we're bringing a lot of wonderful people in. Inma Hernandez has been mentioned, John Brooks as well, and many others, including Beth Kelly, who runs the legal issues around these issues, because these guys are barracudas, Mr. President. They will take you down, slice you in little bits. And Howard's been there. It's no longer happening. You've got sharp folks. We're open for business. It's a generational opportunity to serve, and people are showing up. God bless you. Let me introduce now Chris Klump, who is just makes my life easier every day. I'm so proud of him.
All great deals are rooted in principles.